Hi, I'm Dr. David Rosensweet, and as many of you know, because if you're a Target Method subscriber, you received from the pharmacy something called a starter kit, and you received an actual sample of it. And then there's several hundred of you that handed me your email address during ACAM or A4M for other reasons, and what I was talking about at ACAM and A4M had a lot of different components to it, and one of them was the use of the oils. We've had so many inquiries about it that I decided to record this webinar to help you gain a little bit of an understanding of it. We have a more expanded version of this presentation about the starter kit, but we wanted to give you the short version as well. And one thing I'd like to emphasize, having done a lot of work with physicians on this, is that the very best way for you to learn anything is having a no-charge consultation with me on the phone. I love to do it. And when you and I get on the telephone and we get to deal with your questions, usually I have found over time that the webinars, I think they're great, they're very useful, but there's nothing like us, you and I conversing together on the telephone. So email me at drr@iobim.com. We can have a private conversation or conversations as I have with many doctors in an ongoing way. It's fun. We're really on a mission to get the treatment of women in menopause as safe and as elegant and as excellent as we possibly can. I want to talk to you about the starter kits. What you're looking at on the screen right now is what you actually hand your patient in your office. And it's no charge to you and no charge to the patient. And it's a full prescription. It's not a sample size prescription. This is what they would actually get if you were to prescribe it in a recurrent way. Very rewarding. Women are coming into your office, my office. It's a little surprising to them. At the end of the visit, they actually get handed what they needed to get going. They don't have to go to a pharmacy. They don't have to wait for something to be compounded for them. They don't have to wait for something to be shipped in the mail. It's very rewarding. Let me unpack it for you and show you what's in it. On the left, you see a bottle of Bias, 30 milligrams per milliliter. On the right, a progesterone with 200 milligrams per milliliter in this 100% organic oil. I've done a couple other webinars that describe why I have gone to these in such a big way, not as a total tool. You have to have a lot of tools a lot of vehicles in your toolkit, but these are my favorites. Bias, boy, it absorbs so beautifully in the oil, and 80% of the women that I start off with this particular prescription, they stay with it. Sometimes you got to tweak the percentage of estradiol and estradiol in it, but I have more of that on the other webinars. On the right, the progesterone, 200 milligrams per milliliter. And let me show you some other things that are in this kit. This is a DVD, and this goes to your patient, and it's 12 minutes, and it teaches the women how, where, when to apply the hormones. You get your own personal copy of this, so you can view it as well. It's a time saver in that office, having gone through that particular teaching statement about how to apply these so many times. I mean, it's wonderful to give them the DVD. They also get a double-sided laminated card that lists the symptoms of estrogen, progesterone, and testosterone insufficiency and excess. This really helps them with titration. Of course, is in the Target Method, and of course, so many of you are familiar with titration, starting dosages at a lowish and gradually increasing to alleviate symptoms of insufficiency while falling shy of excess. This is a very useful tool. Women keep this for years in my practice. This is a little business card that you can hand them, that you can make a couple choices about starting doses. You'll have your own. I chose these two because they're the most common starting doses. Depending on the sensitivity and the perceived need of the patient, you're going to get a lot of good results on one of those two starting dosages. There's a flip side of this that gives a little bit of information for women, mainly to alert them to breast discomfort. Because what's the bottom line? We want to keep them safe, and we're a no breast tenderness practice. Here's a little insert that's about the size of an index card that gives them information about the bottle. All of this is covered in greater depth on that DVD. Because these are prescription items, and even though they are no charge to you or to your patient, the pharmacy must have a record of the actual patient that these were given to. So once you hand this to a patient, your office needs to fill out all this information: name, address, date of birth, city, medication allergies, phone, etc. And what this will tie the specific kit that has these specific prescriptions with those specific prescription numbers in it. The pharmacy's already pre-entered those prescription numbers on this. And then you can, if you want, you can list what you prescribe for them. That's more for your record. This will be customized to your office information. And one time and one time only, they need your DA number. So every time you hand out one of these kits, it's imperative that you send this back to conform with pharmacy regulations. And you fax it back to them, and you can order 4 more kits. Should you prescribe these in a recurrent way, this is a fax form, there's a checklist, and there is a longer form of this webinar that I have made out that I go into significant detail describing to you various aspects about it. This last one that I've just filled in there, where it says, want your current gel or cream prescriptions converted to oil, write in what you currently give in the pharmacy, and I'll back this out for you so you get to see. You enter what you're using, let's say Bias. Let's say into that box you put Bias, and you're using a 2.5 milligram per milliliter cream. It's an 80-20 ratio because you know that, and that's your SIG, 1 milliliter BID. Well, the pharmacy will convert this, if you want to use the oil, into the dosages of oils that you need, and that would convert to 4 drops in 24 hours or 2 drops BID. Same for the progesterone. Again, I do a much longer version of this introductory webinar regarding the starter kit for you, and so it's available. We'll be giving you the link to it. You can also prescribe other medications and other compounded formulations. This pharmacy is full service. They're 30 years in business. These are very, very savvy and excellent pharmacists working on one of the most beautiful compounding pharmacies that I think exists in the United States. There's a place for additional notes. We fax this form into their fax number, and they will fax it back to you with an initial on it that shows your office that this your prescription was received. Recorded webinars, you can find them if you're a prescriber to the target method. You can find them on our website. You just use your regular login, and you'll find those webinars that are recorded. For non-subscribers, if you log in to that website using the login name webinars and use the password welcome. Now, again, the best way to do this, to learn anything about this, and I've learned this from quite a bit of experience, is email me. Sometimes you might be available. We can talk privately on the phone, no charge. I'd love to share this information. I'm very committed to getting treatment of women in menopause very excellent, elegant, and safe as is possible. And I find that through a conversation or 2 or 3 privately with physicians, this is where it gets really efficient, where I get to answer the specific questions that you have, because many of you are extremely knowledgeable, some are partially knowledgeable, some are new to the field, and it's much better if I customize it to what you want and what you need. Good to spend time with you. Bye-bye for now.